A 34-year-old man presents to the emergency department with polyuria and polydipsia. Biochemistry results demonstrate a raised plasma osmolality and a low urine osmolality. Which of the following is the most likely diagnosis? Options are A. Diabetes mellitus, B. Addison's disease, C. Diabetes insipidus, D. Conn's syndrome, E. Syndrome of inappropriate ADH secretion. Pause and answer. Answer is C. Diabetes insipidus. Diabetes insipidus is a metabolic disorder characterized by an absolute or relative inability to concentrate urine, resulting in the production of large quantities of dilute urine. It may result from an absolute or relative deficiency of antidiuretic hormone, ADH, which is produced by the hypothalamus and secreted via the posterior pituitary, or by resistance to its action within the renal collecting ducts. Clinically, it manifests as polydipsia, polyuria, and hypertonic urine. Both types of DI may be associated with hyponatremia, and this may present as a medical emergency. The biochemical hallmarks of DI are high plasma osmolality, low urine osmolality, high urine volume, plus or minus hyponatremia. A 47-year-old woman presents to the emergency department complaining of palpitations and heat intolerance. She has no past medical history. On examination, you note a fine tremor and finger clubbing. Her observations are recorded as heart rate, 105 beats per minute. Blood pressure, 145/95 of a millimeter of mercury. Respiratory rate, 20 breaths per minute. Oxygen saturations, 95% on air. Temperature, 37.3 degrees Celsius. Which of the following is the most likely diagnosis? Options are A. Acromegaly, B. Cushing's syndrome, C. Hypothyroidism, D. Addison's disease, E. Pheochromocytoma. Pause and answer. Answer is C. Hypothyroidism. Suspect a diagnosis of hypothyroidism if there are one or more symptoms of rapid onset malaise, fever, and thyroid pain. Compression symptoms of breathlessness, hoarse voice, dysphagia, neck pressure. Agitation, emotional lability, insomnia, irritability, anxiety, palpitations. Exercise intolerance, fatigue, muscle weakness. Heat intolerance, increased sweating. Increased appetite with unintentional weight loss, diarrhea. Subfertility, oligomenorrhea, amenorrhea. Polyuria, thirst, generalized itch. Reduced libido, gynecomastia in men. Deterioration in blood glucose control and hyperglycemia in people with diabetes mellitus. Deterioration of comorbid heart disease, for example in the elderly.